I'd like to warm welcome to Patricia and Sonia. And Patricia's going to kick off the presentation this morning.
Hiya everybody. So I'm Patricia Burns, as Paul's just introduced me. So it's great to be here, and thanks very much for giving your time to come to the lunchtime seminar. Would love to be there in the building with everybody, but it's not possible for obvious reasons. And I suppose at least we can continue to do these things. So thanks very much for coming to listen to myself and Sonia. So I'm just going to talk through some findings from a study that I carried out in 2019. And at the time I was working for one of the healthcare trusts, and now I'm currently on secondment with the Open University as a staff tutor and lecturer in social work. So the title of the study is Service User Involvement, a study of the experiences of social workers and service users in adult social services. So it's quite long-winded, but so it was a study really about how service users were involved with social work and social care staff within adult services, and really about their experiences of that involvement of collaborative working and working together. So the study was part of a master's program with Ulster University, and both Sonia Patton's going to speak and present her findings shortly after me, and we both did the same program. And we met each other through this program, and since we've become firm friends, and we're also partners, and we work regularly together to raise awareness of the importance of involving people with experience of services. So we worked together very collaboratively, just raising awareness and kind of presenting the findings from our research. We're both committed to more participatory approaches and actually more democratic ways just of organising things, whether that's the development or planning or delivery of services. And for myself now in the Open University in social work education. So it's really with a view to developing services that people really want and need, as opposed to them being designed maybe without involvement, and there wouldn't just be that insight that would be required to develop things that people actually want. So just before I start into the study, a quick comment really, or note about terminology. Both myself and Sonia, and we do discuss this in our research study work about the term service user, and we do recognize that it can be a bit problematic, probably not least because it creates a false sense of separation between people, and between workers and between people who use services. And I dare say, for some of you listening, that will resonate with you. It's a kind of a false separation that isn't helpful, but for the purposes of this study, I use it, and I think Sonia used it as well, because in the absence of any sort of more widely understood term, we don't really know how else to frame this. We do see people with experience of services, which is better, but it's sort of like a sort of a short term for that. But what we really do feel is that it's more important to focus on really involving people rather than get hung up on rhetoric, or hung up in terminology. So I think both of us come from the same point of view where that's concerned. So just then as well, just to say, as I move through my slides, Jenny's very ably supporting me. I have no control over the presentation at the minute, so I'll just be asking Jenny just to turn on the next slide, and hope that's not too distracting. But Jenny, yes, brilliant. Thank you for turning on the next slide. So just for the study, then the method I used, it was a small scale research study carried out in 2019, and I've already mentioned it was in the Health and Social Care Trust. We used qualitative methods, and there were 13 study participants. and semi-structured interviews were so semi-structured kind of means I had a set of interview questions that were designed as part of the research design, but there was an element of flexibility there, that just in the conversation with people, you know, I could ask other things. So it was semi-structured interviews. 6 service users took part in the study, and they were all at the time in receipt of services from adult services in the trust. There were 7 social workers, and they came from a range of services, from services supporting older people, learning and physical disability, mental health.
Connection seems to have gone there. We'll just bear with us and we. Patricia has frozen, so hopefully. The joy of digital technology, huh? I'll just send a quick message. Completely. Maybe at this point, Jenny, Sonia, would it be better if we move to your part?
Yeah, absolutely. Yeah, that's no problem at all. Yeah, that's.
I can't even fix Netflix, so I'm already I'm not going to be able to sort this. So apologies, everybody.
Yeah.
Back to Patricia.
Okay.
Jenny, can you get Patricia's presentation up there?
That's what I'm trying to do.
Thank you. These things always work very well in practice and planning. So bear with us.
Okay.
Thank you, Jenny. Sonia, over to you. And
okay.
I'll pick up with Patricia in the back.
Okay, no problem. Well, thank you for allowing me to present here today. My name is Sonia Patton, and I'm a service user and patient advocate. And as Patricia said earlier, we use the term service user because in my experience, I'm a service user of cancer services. In cancer services, I'm actually called a consumer. I've been called a client. I've been called lots of different things, but at the end of the day, when it comes to it, service user seems to be the one that you know resonates more with me. And again, I don't tend to get hung up on the title. I also put in that I'm a patient advocate because I also do quite a lot of work within cancer research and health and social care research. And that for me is my experience. And so what I'm going to like to talk to you about today is the study that I carried out as part of the research methods master's course at Ulster University. I was asked back in 2016 to become to be the first service user and was the guinea pig on this, working alongside social workers. So this study is what I chose, and which has since been published. I'm glad to say. So the title is "Does Training Co-Production Lead to Any Real Changes in Practice?" And it's based on reflections from practitioners. Next slide, please, Jenny. So the strategic number, or priority 7 of the social work strategy says that any research, evaluation or audit activity should promote the principle of practice and of equality and human rights. And it was really that social work research strategy, when it was launched back in 2015, I was asked to talk at it. And, you know, to be perfectly honest, at that time, when it was first launched, I really found it quite hard to affiliate myself with social work, because I was a cancer service user, and I didn't know very much about social work. But really, that really didn't matter, because I was asked then, as I said, to trial the creation of a service user and care module at the University of Ulster, and the Health and Social Care Board actually funded my position in it. So this, the course is actually unique in the UK and maybe further afield, in that it is service users and care modules that are designed akin to postgraduate, post-qualifying practitioner modules in social work. So they're at the same level. And the outcome of that is a master's in the development and co-production of social care research. It very much resonates with the whole social work values, as I see it, the parity of participation. And what I found that it acknowledged, you know, the service user and care's experiential knowledge through the course was absolutely fabulous. There was myself along with, I think, initially 20 practitioners, but as the years progressed, that became less. But I developed really good friendships. I came away understanding the complexity of social work, not saying I am a social worker, but it really gave me a complete insight into research and how it's based and how you go about conducting research. And it also took into account my knowledge and skills based. And I found that you are trained in rigorous research methods, which was absolutely fantastic. So in December 2019, I became the first service user in Northern Ireland to graduate with a master's in the development co-production of social care research. Next slide, please. The study design and methodology, it was a small scale qualitative survey. It was a study, it was a purposive sampling approach taken. And what I mean by that, it actually looked at a particular training course, which was called Involving People. And it looked at the training cohort in 2016, 2017. And looked at the participants. There were 18 participants. There was actually 20 participants. There was 2 service users and 18 statutory, community and voluntary sector. But because I was the service user and the other service user we couldn't be anonymized, it ended up that we selected just the participants of the course, community, voluntary sector and statutory. Of the 18, only 5 signed up for it. It was semi-structured face-to-face interviews where I travelled to each of the locations where the people worked. The interviews were recorded. I transcribed them all. To avoid bias, I also had a colleague within social work actually work with me and confirm the analysis and the free text analysis using Broad and Clark, the coding. And from that, from those interviews and from the text, several themes and sub-themes were identified. Next slide, please. So the key findings from this were that many of the sub-themes and sub-themes were interrelated. And so I think I ended up with something like 20 themes and God knows how many sub-themes, but I had to recode and recode and recode to bring that down. And for the purposes of my study and the article, I could only focus on the key findings, which are these three. So knowledge transfer and the value of co-production training, social inclusion and the voice of the service user, and organizational structure, leadership and culture. So in the first one, knowledge transfer, we asked questions about the knowledge of co-production and PPI prior to going on this course and then afterwards, trying to understand what people knew about co-production or what they thought they knew about it and what it was. And for what the findings was that many people were doing it, and similarly within the community and voluntary sector, there is a vast amount of co-production that's going on. Absolutely brilliant work. And then, you know, we've got statutory where really it's almost in its infancy, but in doing this course, which was called Involving People, it brought together all those participants and ideas were bounced off each other. And when I went to do the interviews, like a year later, it was great to actually see that people were putting in place some of the learnings from the course. So some of the comments that I took from the knowledge transfer was, I thought that we were doing co-production, but really we're only doing PPA. And one of the comments post the course was, when management put forward now that we're co-producing, I knew feeling able to speak up and say, we're not. And in fact, we're only scratching the surface. That was a comment that came from a statutory participant. Other comments were that it was really important to listen, respect, and empower your service users. There was a brilliant comment that, which is very much alluding to the social inclusion of the voice of the service user, was that my job is to knit and sew people into their community to the point that we are almost irrelevant. So she was actually a director working with the community and voluntary sector, and I thought that was such a brilliant comment. Other comments were that the course had given them greater confidence to be analytical and to know that they were doing co-production. And alluding to organisation structure, leadership and culture, it was all about culture, was about putting the client first and putting them at the heart of the services. There was some very positive comments with regards to leadership, and as that management were the enablers. They were always open to what I was doing, so that was good. But there was also some negativity there as well, because it felt, you know, there was the tokenistic approach that some of the interviewees alluded to, and it was that, you know, really it was more to do with time and resources. Next slide, please. So this slide, I know it's a very busy slide, but it talks about the discussion and implications. So what the course actually did, it offered an opportunity to interact and learn from each other's perspectives and reconcile different views, because there were different views in what a service user thought, or what a community and voluntary sector thought, or what somebody from statutory thought about co-production. It challenged the complexities and the barriers to co-production. And as I stated earlier, often it was a lack of strategic support, more so within the statutory sector. The course increased understanding of co-production and how this would best serve the service user and allowing them to affect change within their organisation. Resonating, all participants did say they gained a deeper appreciation of the service user and how the service user voice was integral to the success of the projects. And coming out of this, the findings would show that in order to address all the complexities regarding co-production involving service users within co-producing, there needed to be a whole systems approach that, you know, within the integrated care hierarchies, where you've got so many different organizations all working with service users, but again, there needed to be coherence, there needed to be collaboration. And at the bottom of that, I have the quote, seek first to understand, then to be understood. That was the facilitator of the course, Richard O'Rourke, who sadly is no longer with us. He was very much saying for all candidates, you need to learn about each other, you need to understand each other's point of view, even if you disagree with it. Because it's only in understanding that you'll then actually learn and move on and be understood, because the voice of the service user is extremely important, but sometimes the service user voice might not be what people want to hear. And sometimes we might not want to hear what, you know, so it's a case of understanding each other's roles and where that role is coming from and where that experience is coming from, because it's important to understand that before you can collaborate, I think, in co-production. Next slide, please. So conclusion of the study, it definitely drew on the value of the co-production training. It enhanced participants' confidence. It acted as an enabler to further deliver service user improvements through meaningful service user engagement. It highlighted very much co-production strengths from the community and voluntary sector and how these could be transferable to statutory, and addressing barriers and opportunities, and through doing so, ensuring equal and reciprocal relationships with service users and carers. It definitely, you know, it was one of those kind of light bulb moments where you had people from statutory saying, you know, we thought talking to, you know, including the service user was, you know, doing focus groups and doing this, but it was very much about, no, the service user being centric, being there at the early stages of any idea or part of the strategy of how to take things forward. So it was absolutely fantastic that we had conversations at that stage of how statutory could learn from the community and voluntary sector. So that was fantastic. And although my study was set against the background of Northern Ireland, when I did my research, it was supported and evidenced by the principles of other national advisory groups in co-production, for example, the Social Care Institute of Excellence involved, and the King's Fund. Next slide, please. So I put this slide here because I thought, you know, I need to actually show what's next as opposed to just concluding, because since I've completed the course, since I've got my master's, quite a lot has happened. A lot has happened for myself, personal development, but a lot, I believe, has happened in the last year in co-production. So what you see behind you is a word cloud, and that's basically two hands coming together. And all those words that you see behind you are all the word clouds from my article. So you can see things like research, social work, leadership, participate, co-production, evaluation, study. So I like that quotation. The way to get started is to quit talking and begin doing, because there was no point me doing a master's, no point doing all of this for me if I wasn't going to do something with it. Next slide, please. And really, I talked just earlier about the whole system approach. So from the study, the recommendations that went forward, that there needed to be a whole system approach for health and social care. So looking at what's happening elsewhere, the public health agencies of England, Scotland, Wales have already adopted this whole systems approach. So Northern Ireland has got some key strategic documentations where this is already happening, making life better, a whole system strategic framework for public health. There then was the Delivering Together, the 2014 document, and then it's updated in 2016. And the Public Health Agency, it also called for this cross-sectoral and multi-agency approach to working together. I think one of the key comments was to strengthen collaboration and coordination to deliver on shared strategic priorities across all sectors at a regional level and on supporting implementation at a local level. Next slide, please. So what is a whole systems approach? What does it look like? So a review of the original strategy in 2015-2020, and that was the strategy for the social work research and continuous improvement strategy. A review of this was taken in 2019, and it gave the impetus for the establishment of a network of interested stakeholders. And from that, what came was building a research community, and it was a title established for those stakeholders, and it was in an effort to develop a sustainable research community to work collaboratively on research opportunities that could arise within the integrated health and care system. The research community is drawn from a range of backgrounds and includes service users and carers with knowledge and competence in research evidence, statutory, community and not-for-profit sectors, social workers and academia. I believe this is a significant step forward towards a whole systems approach and with leadership at the helm. And social work values are definitely very much embedded in that, the whole co-working, collaboration, participation, also values of co-production. These are at the heart of building the evidence base relevant to social work and social care in Northern Ireland. Next slide, please. So I'm really delighted to actually present to you today the launch of the revised strategy that the team, the building a community, building a research community is behind. And so the social work and social care research evidence supporting continuous improvement in service outcomes strategy was launched yesterday at the Social Work and Social Care Research Conference. It is a key document that embodies social work and social care values, and very much at the heart of that is the co-production, co-working, collaboration, participation. In fact, I participated in the conference yesterday, and it was absolutely fabulous to hear about the amount of service user involvement, service user participation in projects that was going on within social work and social care. This document defines the leadership that's needed and the relationships between policy, practice and service users, because it is much more a case of leadership coming together to actually bring this all. And it's not leadership being in a very high level, it's leadership giving service users that understanding of leadership and how they can drive something through. And what it has done, it enhances professional and service user and care learning and development opportunities to build competence and capacity in light of the changing context of practice. I'm not sure if you can see below, there is a live link to this strategy. So anyone can click on that and it can take you in and give you the details of what's currently happening. Next slide. Oh, the other thing I should say about it is that when we talk about co-working, collaboration, and participation, we're talking about service users, we're talking about non-profit organisations, Salvation Army, Bernardo's, we're talking about the wider HSNI organisations, so the Health and Social Care Board, NISC, NAGALA, R&D, PHA, SIPS, all the social care trusts are involved. Government, we have the Northern Ireland Social Work Leadership Network, the Department of Health, Department of Justice, and we have academia, we have Queen's, Ulster University, Open University and the Healthcare Library in Northern Ireland. So you can see it is a huge multi-collaboration approach, and it's very much that whole systems approach that we were talking about. Next slide, please. So really to end my talk, I wanted to share with you this slide, and it's this quote: "Until you value yourself, you won't value your time. Until you value your time, you will not do anything with it." And I think that for me, after working 25 years in procurement and then becoming a cancer service user, cancer services user, and then a patient advocate, for me, that time since that diagnosis, I can't believe how much has happened, how much my life has changed. I never thought coming up to the age of 50 that I would be doing a master's in research evaluation methods. I really did doubt my ability and capability to learn and develop skills in research and methodology. And I often questioned how my advocacy role was relevant to social work and social care. But thankfully, I persisted, and it was down to Anne McGlade, the research lead at Health and Social Care Board, and the academic staff, and also the practitioners on the course, for their belief in the service user role. And 5 years on, I'm glad I did take that time, to say I could do this. And because the opportunity, my work ethic, my self-efficacy and my value has changed. And for me, it's been truly transformative. Next slide, please. And really, that's me. Thank you very much for listening. I've attached the article, and if you can access the article, and it's myself, Anne McGlade and Joe Elliott. And you can read about it there. And any questions or any queries that you have, please feel free to contact me. My details are at the bottom of the screen. Thank you very much.
Thank you, Sonia. And I'm glad you also took the time to do the work that you're doing. That's very valuable. And thank you for your input this morning.
You're welcome.
We'll pose later after Patricia's presentation.
Okay.
Again, Patricia, welcome back.
Thank you.
Be for you.
I just got kicked out, I think. I thought everybody got kicked out, but clearly it was just me.
I know what it's like. Well, I was as anxious as you were, so don't worry about that. Listen, you're very welcome back, and we'll try and get your presentation back up. It's probably makes sense to start again because you weren't too far into it, if that's okay.
Oh, I think I was just on the methods, if that's okay, Jenny.
Okay.
So Sonia's always a very hard act to follow, by the way. So, honestly.
Thank you.
Hold on, I'll just get myself into a bit of a groove. Okay, so Jenny, are you okay just to go to the method slide? So I think I probably got to the point of kind of talking about how many people were involved in the study. I'm not sure where I got to. Yeah, Sonia's not. Yeah, so I got to the point. There's like 6 service users, 7 social workers. All of the study participants had some level of involvement in like advocacy groups or in-house training with service users, kind of working collaboratively. So the expectation for participation in the study was that for social workers that they would be working in partnership levels kind of higher than the norm. So not just in terms of working in partnership with someone's individual care plan, it would be that you were actually involved in activities outside of that type of one-to-one work. So the important thing about the methods would be that the study was co-produced, and Sonia had mentioned this very eloquently about co-production being a meaningful when the person is involved from the beginning of anything. So I was very fortunate in carrying out this study that I had a group of an advisory group made up of people with experience of service users and service user experience, and also a wide experience of different co-productive activities. So they kind of were involved from the beginning, making decisions at the beginning of the research, even to, you know, what we were going to look at, what questions we were going to ask in the interviews. So key things about the study design. So we met regularly as the research advisory group, and this really was like a really rich experience for myself. Because it was like an exchange of ideas, you know, a meeting of minds, and really an opportunity for me, you know, when I had decided certain things, which you will inevitably do, and you think they're a very good idea that you're having. And I was very kind of confident about that. When I would go in and discuss that at the research advisory group, I would come out with something different. Okay, because I took on everybody else's perspectives. And I kind of think that not only was a rich kind of learning experience for me and the group as well, but it added to the quality of the research. So it just wasn't based on what I thought was a good idea. You know, I thought I did have a range of good ideas, but then when you listen to other people and take on their perspectives, that can change completely, as long as you're open to listening about to everybody else's perspectives. So that's probably the most important thing about the methodology for the study. So Jenny, can you move on to slide 3? So the context of the study, really, so partnership and collaborative working with service users and carers, it's kind of a long-standing expectation in social work legislation and policy, and certainly in social work education, it's kind of mainstream. And we do have a legal requirement here from 2009 to involve service users in planning, delivery and evaluation of services. And as Sonia alluded to, this happens really, really spectacularly, and there are excellent examples there, as we both experienced at the research conference yesterday. If some of you were there were great examples shared of projects that are going on. But certainly in certain sectors, maybe it happens more in certain places than in others. But we have a sort of a significant policy drive towards newish terms. They're kind of a new term to us, like co-production. So we have things like the Bangor report mentioning co-production as kind of a clear pathway forward, and certainly in our social work strategy. It's key. It's considered a preferred approach. So it means that whatever project's going on, or whatever piece of work or a new service is being designed, that, you know, people with experience of that particular area should be involved in that work from the beginning. So so this is very much embedded in our social work strategy. And also the Power to People document, very recent, about, you know, the recommendations around the reform in social care, suggests that we put, and it's a really nice terminology, you know. I hope you heard the bit I had kind of alluded to about terminology and how problematic it can be, but they use the terminology of citizens at the heart. And which I think is just a really nice way to put it, because we are all citizens equally, and we're all concerned, we all have a vested interest, and they use the terminology citizens at the heart of decision making, design and delivery of services. So I kind of think that's kind of powerful language for us to use. Jenny, could you move on to the next slide? So just the part of the research process. And I had a person who had experience of services that did some training to work with me in terms of identifying themes from the interview transcripts. So we used a software to do this, and 2 people. Sonia also said about reducing bias. So myself as a social worker, and I had a person with experience of service who had the training to use the software and could use it, and I couldn't, which was crucial. So we worked through all of the transcripts, which were kind of cleaned of any confidential information. So and we identified themes, and we organized them broadly into two main areas. So people with the experience of being involved either as a service user or a social worker, we kind of looked at what factors enabled that involvement, and then the challenges and barriers to the involvement. So there was 2 sort of broad themes that we organized. They kind of, because you sort through reams and reams of words to get to this point. So there's quite an intense process. Jenny, can I ask you to move on to the next slide? So in terms of factors that enabled involvement, for service users, they identified factors as feeling valued. So this would be, things like feeling listened to, opportunities to contribute to decision making, that they were really involved, that anything that they had said in a meeting, was listened to and then possibly acted upon, so they could see real change happening because of their involvement. So but we hear a lot of a discussion about things like outcomes. So for the people involved, for all of us involved in anything, we like to see that something has made a difference, that our contribution has made an actual change to something that we're involved in. So those things were considered as centrally important to feelings of value. Relationships were also identified as enabling involvement. So it was quite a big discussion point in terms of the approach of the staff involved in either in the group or in training. So, the approach of the people. So in terms of building that relationship, that staff were friendly, informal, open, and caring. So this is like, creating a nurturing environment. I know that's not new, so that's kind of like something that we nearly expect to happen and should happen, but very crucially identified by service users as being important to enabling them in their involvement. So other things that were mentioned were support, and this was both practical and emotional support. Things like hospitality, nice places to meet, and I know we're all kind of robbed of that at the minute because we're all in the online environment. But comfort, creature comforts, coffee, sandwiches, those things. Neutral and convenient locations. Not always places for meetings or activities, maybe not always in a health centres or trust buildings. A lot of the times when it worked very well, there were other buildings used and they were more accessible to service users that weren't a drive or a bus ride away. So timings of meetings, and also very importantly, breaks from caring responsibilities. That was really very important. So for social workers, they also identified relationships. So this was helped them. They found that in making their relationships, they were achieving a better understanding of service users, better understanding of lived experience. They also felt it was congruent with their professional value base, which isn't surprising. We did have examples where people talked about how when they got involved in activities, their morale was improved. They felt like they were working to their social work values. This was giving them a boost in how they experienced their job role. So some job satisfaction, and then also an enhanced better understanding. I've mentioned that already, and enhanced insight into lived experiences and the day-to-day challenges that people are facing. So they also, for social workers, they highlighted support for service users as being crucially important. Things like induction, training, capacity building, as Sonia has talked about as well, building the capacity of people to contribute in very meaningful ways, and then also practical and emotional support. Now, interestingly, social workers identified as important was payment. Now, I suppose I say interestingly because service users didn't mention this at all, really, and it was mentioned by social workers. And I kind of, my own personal thoughts on that are maybe that people are just too polite to mention that, or it maybe is something that you just don't feel comfortable talking about. But it was definitely an issue for social workers who felt that part of supporting service users to feel valued was payment. So, also organizational time, organizational support, very important for them, and structures for involvement, which may be in existence in some places, but maybe not in others. So time and resources are crucially important. Are we okay to move on to the next slide, Jenny? So just, it's really important to, we hear the voice of the study participants, and I've put a few direct quotes here into the presentation, and I think they're they're kind of important for us to hear the direct voice. So so the first quote is from a service user. So it was clear we were valued genuinely throughout, and most importantly by those managing the process. This is hard to fake, and all of us can tell the difference. The relationships we have are testament to that. So that was a person who felt that their relationships were what made the whole process work, and that you couldn't fake that, and you can't really fake that. We're all human. It's not you can't fake that. So, and for a social worker, then you just felt good about what you were doing. It just reminded you of why you were a social worker in the first place. You just felt so good. Everybody was like this. So that's a social worker describing a level of job satisfaction. Can we move on, please? Thank you. So, so just on relationships, then, you know, unsurprisingly, they're considered to be a major enabling factor for people. They're a key factor motivating service users to get involved and then remain involved. Indeed, you know, relationships make the world go round, and you know, we need to spend time nurturing these and paying particular attention to individuals' needs and also their circumstances. Service users highlighted that they do need support with things like practical support, emotional support, and things like time away from carrying responsibilities. The personal qualities of social workers, have mentioned that already, you know, friendly, informal, approachable, you know, willing to make those relationships. Interestingly, some service users talked about direct benefits of being involved with the organisation to their own social well-being. You know, they had an increased sense of purpose, a sense of belonging. They got some personal satisfaction. There were increased opportunities for socialising, keeping active, and then connecting with their community. So they had a very positive experience. And then for social workers, it was a, you know, congruent with their professional value base, something that improved their morale, their job satisfaction, and they felt that their understanding was enhanced. So there were some challenges for social workers around more relaxed boundaries, and I imagine if there's any questions at the end, there might be a question on this. So really just that, you know, there were dynamics that were at play, and that, you know, social workers did really think that, you know, this shouldn't be viewed, service user involvement co-production shouldn't be viewed as unproblematic, that we need to have some critical thought around this, that, you know, we are managing relationships, there are complexities involved, and sometimes in terms of managing professional boundaries or even competing agendas, or, you know, that it is complex. And they also felt as they felt that service users needed training and support to build capacity, they also felt that they needed that as well. So that was very important. Can I go on to the next slide, please? Okay, so this is another quote, and I thought this was really quite powerful, and I've included it. It's a direct quote from a person who you know, was a crisis at the time when a social worker came to her door. And I thought I used this quote because I thought it kind of illustrated the point of from that first visit or that first connection with another person, either as a social worker or as a social care worker, you know, what can happen. And Sonia talks about that journey that she's been on, and we're all on. So, you know, this was somebody who I thought kind of put this very well. So they had said, when she knocked my door, I couldn't even have told you my name. I didn't know what end of me was up. I was at my wit's end. She just listened and helped me decide things, just like what to do next. But she just cared. I don't know how, but I ended up getting through it. We just had a good relationship from the very start. I've gone from that to being involved in everything going. I even speak at conferences now. So that's somebody who is at a critical point in their life, at a crisis, couldn't see the wood for the trees in terms of making a decision, and a social worker knocked her door and went on that journey with her. So I just kind of thought that was very powerful. So in terms of factors that challenges and barriers then, I don't know that they're going to be very surprising to anybody, but there really are for service users. They were really around things like accessibility, both in terms of information, like complex bureaucratic procedures within the organization, complex policies and procedures, feel they're barriers for everyone. But things like physical accessibility, transport, location of meetings, how things are organised, being mindful of a range of people needing to get to a place that they maybe don't have a car. And for those who did have a car and could actually access places without support or using public transport, then maybe physical disability for people with physical disabilities, car parking was a big issue. So accessibility in terms of absolutely everything was an issue and really needs a lot of thought. They also found that ad hoc support, so it was a bit inconsistent. There was an inconsistent approach to induction and training. And then sort of some people highlighted privacy around receiving support from a social care support agency, that if they were getting involved very publicly, and that kind of links in with the location of meetings and stuff like that, that they sought privacy around the support that they needed, and if they were getting more involved with a service, it was going to kind of bring that out into the open. So that was a big concern. So in terms of challenges and barriers for social workers, it was support structures. It was the same support structures for service users, the same thing. Structure, sometimes a lack of clarity around expectations, outcome, lack of clarity about how people are going to be paid. So they wanted very firm structures around a very firm structure around involvement and involvement structure. They find it challenging. Some find it challenging managing more relaxed boundaries. So the complexities, and just what I said earlier, that they did feel strongly that nothing that is worthwhile doing is ever easy anyway, and that there are complex dynamics that can be involved. So a significant issue for social workers was and we know this, the workplace culture, pressures of work, paperwork, processes, volume of work. So can we move on to the next slide, Jenny? So just a couple more quotes then, just to give you that sort of insight into what people shared in the study. So from a social worker, this is just kind of about bureaucracy. So sometimes service users are just expected to know how we do things, and that's just not right. How can they know how things are done? We go through years of training and on the job training, and it's still sometimes a struggle for us to know how things are done. And I kind of agree with that completely. I totally agree with that. And from a service user, it would take a long time to get to grips with how things are done in the trust. Things are so complex and there's a lot of bureaucracy. So, and then just I included a quote here about payment. A social worker had articulately said, then I really do think if we're asking service users to give their time, then they should be properly paid like everyone else. So there are just a few quotes there. And I do have one other quote then from a social worker. I just thought this was a good way to like sum up the whole thing, because from social workers and service users there was a real core belief in this way of working, a real commitment and a real core belief in the value of this way of working. So it's about being proactive in advocating for service users and for us as social workers. I kind of thought that was really powerful. So we advocate for one another together. We need each other for this advocacy role. We must fight this bureaucracy and paperwork. There has to be ways of robust assessment, care planning, recording that can still give you the time to be with the service user. The most important skills of a social worker are interacting with people. So I kind of thought that was a nice way to kind of to bring the presentation to an end. Can I just go on to the next slide then? Before our conclusion. So the conclusions of the study were, it builds on existing research, and there's a lot of research in social work education, and it kind of builds on that, and it's useful then for to examine the complexities of service user involvement outside of the university setting. And this is good for students in preparing for professional practice. You know, you want students to start as they mean to go on. The study makes a good contribution, I think an important contribution to the continuance of this approach. And hopefully in making this a mainstream approach and how we organise everything that we do. There's more opportunities now than ever for social workers, service users to get involved. And for this, then there needs to be more training and structure to support this, and then also considering it from social workers' point of view and also social care staff point of view. There's an increase in expectation to involve service users in an extent that goes way beyond our original notions of partnership working. So they require some support and structure to deliver on this. So deliver on the policy and the legislation. Can we move on to the next slide? So just some recommendations then from the study. It's evident the workforce is under pressure. More resourcing, this is all widely acknowledged, more resourcing and funding is needed, and for service user involvement, it shouldn't be looked at as a quick fix or cheap or anything like that. It requires resources. Organisational support is needed to do that. I don't think that meaningful involvement of service users can be achieved unless there's acknowledgement of the pressures that the workforce are under. And another recommendation, we need to take a critical stance. So I know it is very important to focus on what we can positively do, but we also need to look at the challenges and barriers because we need to innovate around them. So it's part of being innovative and taking these things on and looking at that as a positive as well, that we take a critical stance, and we can find ways to work around these things, push the boundaries, push it a bit further. We do have really good policy, we can push that on a bit more. So I suppose I would dread to think it ever becomes a tick box exercise. There will be examples out there of tokenism, and we never want it to be anything other than absolutely meaningful. Otherwise, there's no point in working in this way. So the challenges and barriers are well established in the literature. There's lots of research there that establish what the issues are. It's probably time to take a bit of decisive action around these things. Can we just move on to the next slide? So this is a final word for me. I can't really not do this because I had so much help in doing this study, and a special thanks. We had so much fun doing it, and my acknowledgement would really be for the Research Advisory Group for all of their support and inspiration. Just for their time and energy, they give freely of it, and they brought a diverse range of skills and expertise to each different phase of the study. And then, of course, I would like to thank all the people who participated with me, because it's not time is everybody's time poor, which is a new phrase that we've all coined. Time is precious, and people gave up their time to talk to me for the study purposes. So we'd just like to give some thanks to them. And that's me. I suppose, sorry, one more thing for me. Thanks very much for listening. And if you do want to know anything about the study, my email address is there. Feel free to email me about it. We're currently working on submitting an article on the study for publication. So when that's available, I'll happily share that with everyone. Thank you very much.
Thank you, Patricia and Sonia. Really powerful presentations this morning, and I couldn't help but think that social workers are enablers, and if anything's going to progress and in relation to co-production, social work will be at the heart of that, along with service users. So thank you for the findings. In terms of questions, more than happy to take any questions anybody has. Just in terms of the chat, again, if you want to pop anything in, happy to raise it. I think your point earlier, Sonia, around the social work, social care research evidence in terms of support and continuous improvement, and I would urge people to download that strategy. It is a requirement that we work in a meaningful co-production way. I was struck, Patricia, around the barriers, and you touched a little bit about them. In terms of trying to, I suppose, continue to develop capability with both service users and social workers. Do you think there's any significant barriers that are preventing that becoming much more in the mainstream?
I know this is an often said thing, but I do think there needs to be a bit of structure around things. So the policy's there, and I suppose there may be some value in terms of looking at gaps that exist between policy and practice, Paul. But time is the thing as well. There needs to be. I do think people. I'm also cautious about saying this as well because we're now in the middle of a pandemic as well. So this study was carried out pre-pandemic, but I do think in terms of sometimes it's quicker to do things in a very fast way and not spend the time engaging broadly as you would need to do. So I just think time, maybe some resources and some structure around involvement. From what I gather from my working experience and through the study would be this is a very well developed approach in certain areas and maybe less so in others. So it would be worthwhile to look where it isn't and what can be done to support the staff and service users to work together.
I think there's something also about getting the real outcomes of good co-production and how that can make a difference is really important in terms of engaging others in the process. Is that something that you think we're doing enough of?
I do. I think there's a good bit of that going on because I think one thing that's very helpful that I find very helpful is to see how people did things from scratch. So, at the research conference yesterday that Sonia had mentioned, there were a few examples shared, and it's really, really good to hear the beginnings and what the challenges were. I find it helpful to hear the challenges because, the end product might be good and the outcomes have been achieved or the aims have been achieved, but it's good. Our learning is very important and we kind of learn from the bumpy bits that we've hit along the way. So I do think there are more opportunities. Would be good to share more good practice, yes, but I do think at the minute we're doing okay. That's my personal opinion there.
Absolutely, and just opening out to people here today, we're more than keen to support you to share that good practice and to bring presentations around how co-production makes a difference in terms of service delivery and the outcomes for people. So any ideas, anybody who's involved in that, please contact myself or Mervyn in relation to that, and we're very happy to have you come along and present. I'm just looking down through some of the chat here.
Paul, there's a question from John Gibson, I noticed.
Yeah, I'm just going through. Dina, you've put in a point there. Would you like to...
Yes, just that we've noticed whenever a number of forums that we would be involved in, that the numbers have gone up of service users and carers who are able to be involved. So that's very, very encouraging because it does help overcome some of those barriers that Patricia's identified.
Dina, hi, I haven't seen you in a long time. How are you? It's really good to see you. That's an excellent point, Dina. So I imagine while we're busy kind of identifying issues from the pandemic in terms of connectivity, I think accessibility is probably improved. Mm-hmm. Is that what the point that you were making, that actually we're now more accessible to a wider range of people? Is that?
That's right. That's right. Because people who maybe had difficulty accessing respite and able to attend various forums, that's no longer the big issue that it was. And certainly even in terms of our own, organisation, service user led, and it's in terms of making sure we've got a quorum, we've had a very few problems because those people, it doesn't matter whether they're in bed, they can still participate. So it's while it's brought a lot of problems to people, a lot of people absolutely hate it. It's actually proved to be a wonderful tool for ensuring people's voices are being heard.
Absolutely.
Excellent point.
I think the capability and capacity building with both social work and service users is really, really important. And I suppose the point, I think, was it you, Sonia, raised is something you just need to get in and do this work and get on with it and develop it.
Yeah. I mean, even going back to what Dina said, I can remember my first experience of going into a conference room up at the cancer centre, and all these very important consultants and doctors there, and them all suited and booted, and how I was just like, oh my God, we were that whole kind of feeling of like, who am I amongst all these really important people? But if anything, what you learn, and it is that you have as much right to be there as that person, because you know more about the illness and how it's affected you. But it is, I feel that this whole connectivity now is just brilliant for people to be able to participate. Because, and I think going forward, I mean, my proposal is with the Cancer Centre, where I'm a consumer member, is that we do meetings this way, rather than me traveling to Belfast and traveling back, because you still get the participation, you still get the views. Sometimes you mightn't feel that well or look that good. You can turn the screen off, but you can still have your comments. There's all of that allows participation. And sorry, for me, I guess after after my diagnosis and the end of my professional career, it was very much, I need to see what's out there, and it has to be beneficial for me in the sense that I need to get something out of it. I mean, the masters, I would never have dreamed of doing the masters, because A, I would have had to pay for it, and B, I just didn't think I would be, 3 years of like, God, I'm finished with all that. But the fact that it was a funded position, and there was a bit of a chance it might work and it mightn't work, but it did work. And that then has kind of come along, that there's more service users now behind me coming up, first, second, third year. And we're now currently going out and looking for participants for the next, starting in September. But also important to say, just so it's for inclusion purposes, the university, both universities, Queen's and Ulster University, are collaborating with service users and with other academia and with other organisations about developing a course which is going to be open learning, and it's basically developing a research course. So anyone, it doesn't look, for masters you have to have a degree, but in this case there will be, I don't know what the criteria is, but it's not going to be, it's going to be basically more about your experience and why you want to get involved in research. And I think for all the service users out there that are doing that or working with researchers, it's a really good way of getting into the teeth and the nitty gritty of it, and why service user involvement is so important, because you bring that very important skill set, that experiential knowledge, which to me it's really important to have it, and it's having that service user voice at the center of everything, and also at the beginning of everything.
I know, absolutely, Sonia. And I know from a social care council perspective around developing the curriculum within the universities for social work, we've a very rich input now in a way that we wouldn't have had a number of years from service user involvement and the service user experience. I think the point is around continuing to develop capacity and capability for service users. And Magella's just come on there to say that we still have digital poverty around. How do we support service users to get involved, and the barriers that are around there? Sonia, what's your view on some of the barriers for inclusion of service users in the process?
Sorry, for me?
Yeah.
Barriers. The barriers would be, because the thing that I notice most is training is a big need. Training service user, even training people who aren't necessarily, even on practitioner side, But that is a barrier. There needs to be an element of, certainly the biggest barrier to all, I think, and something that I've talked about, is acknowledging the service users' time, their expenses, their travel. Time is a big thing, because the service user's time is as important as anyone else who's sitting in a room or sitting in a Zoom call. Their time is equally important. You know, where they're involved, where they're being asked to get involved in a study or, you know, participate, design, collaborate, that takes time. And why should service users not get that acknowledgement, whether it be whatever reimbursement means it is? So I think organizations need to get a bit smarter about how they do that, as opposed to saying, oh, that's difficult, we don't have that. But there are ways and means of doing things. So I think that would be a challenge, because if service users can't travel, if service users can't give up their time freely, maybe they're working, then really it's meaning that the only service users that are participating are someone who's prepared, who financially thinks, well, I can do that, you know, I'm going to do this for altruistic reasons, or I've got plenty of time on my hand. But there's a lot of service users who work. So they really have to really think more of service user needs. And the other thing I would say about service user, other barriers would be, you know, like that walking into a room and feeling that you're inferior to anyone. No, definitely not, because if anything, you've earned that place to be there. And from my article, I remember one of the managers, and I think it was one of the foundations, Cedar Foundation, and she said, you want it to be that you can walk into a room and there's service users and there's managers, directors there, and to not be able to tell the difference. And that's where, you know, that participation, that's where the equality truly lies. It shouldn't be, oh, there's the service user, you're part of that group. And it's a choice then for service users to say, well, actually, I don't think my involvement, I think that's been a bit tokenistic. And I've had to, over the last 5 years, kind of say, no, this isn't for me. I've gone into various, work with various organizations, and maybe after a while I've said, no, this isn't working. I feel that what I'm putting forward either isn't being acknowledged, or it's kind of just a bit tokenistic. So it's about the choices that you make, but there are challenges there, but it's very much the organizations really need to get smart about how they are in the inclusion of service users. And if they want to truly co-create and co-produce, then, you know, there has to be funding available in order to do that.
Absolutely. And I think it's just somebody interesting pieces coming up here in the chat here. I'm just looking, Susan Hughes, you posed a question there around increasing co-production. Would you like to put it to the panel?
Yeah, I suppose I was just asking a question about, you know, do you feel there's a risk that the co-production processes can favour the most articulate of service users, and service users who are maybe most familiar with professionals, processes and the language that professionals can use, which can maybe then lead to sort of further inequality in service access for different service users, and sort of what your thoughts would be about that.
Susan, I found personally where co-production was at the heart of the service was in those organisations, mental health organisations, community and voluntary sector, where real co-production existed. And, you know, for all the issues that service users had, it wasn't about how clearly they spoke or how they managed. It was the organisation who had service users at the heart of everything that they did. And when I went out and seen this, you know, I actually walked away with such, you know, I was really humbling, because you could see that the organisations were passionate about having service users, working with them within the community, within their organisations. So, you know, it's not all about talking. It's not all about that. You know, there are other ways and means. And again, it's very much researchers need to find out what the issues are with service user involvement, what the service user needs, and what they need to do in order to make that relationship work.
Thank you. Yeah, I would agree that there's a very important role for the voluntary sector.
Yeah.
In co-production. Yeah.
I think there's good examples as well, I suppose, in community development around how communities work collectively to solve and develop within their own communities. So I think there's probably good evidence around there. And just there that there's I think this is John. You have a question as well, John Gibson.
Unfortunately, John has had to leave.
Yeah, John asked questions. I suppose the question around is person-centered planning different from co-production? I don't know if you just want to say anything.
Can I answer that one?
Yes.
Because actually in talking to both social workers and people with experience as service users, co-production seemed to, like, the process, it was the journey. It kind of started from person-centered planning. So like the quote that I had used earlier from the person who just talked about, like, the social worker knocking her door on the first, like, that first minute, and then there's a journey. So it starts with person-centered approaches, you know, that you're engaging with somebody, and like you could be for all staff, social care staff and social work staff, that first moment of engagement is often at the point of crisis. So at that moment, you're not saying, do you want to be involved in a service planning meeting? Do you know? So like you're just in there providing support, and that's that enabling role, and you go on that journey with the person. And then, and I suppose just picking up, I think it was Jane's question earlier about, you know, the temptation from professionals to engage with people who are involved anyway, or sorry, it was Susan actually, involved anyway, or, you know, and articulate and able to contribute. That kind of does happen because it's kind of tempting to do that. But, and I think just picking up on what Sonia said, when it's not at the heart of what you're truly doing, there's no growth in it. You know, you'll just be, you know, linking up. And we talked about this yesterday, Sonia, about linking up with people with experience of one area, and then they're involved in a range of things because they're able to and feel confident enough to go to the meeting or speak at the conference, but they're not necessarily the best person to be involved in something else in another service. So that actually is impacting on growth.
Yeah.
It's a major issue.
Yeah, and for myself, I'm a service user. I speak for myself, and you know, I know about. I can tell you everything you need to know about breast cancer and maybe other cancers, but when it comes to, you know, because I've done my training in health and social care, and I've worked with people, I feel a lot more confident to be able to speak as I am now today, speaking to everyone here. Whereas if I hadn't done that, if I hadn't had that experience and the training and, you know, established the relationships, I doubt very much that I would, you know, be sitting here. So yeah, you know, that is always the danger. That's service user, you know, if someone who is good, it can be rolled out to do anything. But I mean, I have actually had to say at certain things, no, that's not for me. I really, you know, I personally couldn't see what I could bring to it. And if I felt that way, then surely what it is isn't merely a tick box exercise. So it's that decision that you have to take upon yourself, whether to be involved or not.
It's about being meaningful.
Yeah.
I mean, social work is out there, social care is out there working in service design and service development. So there is something there, there's a big learn there about how we think through to ensure that we have the right people around the table.
That's right.
Well, look, I'm happy to take any questions. If not, happy to close this morning's seminar and to thank everybody for taking the time. You know, everybody's really, really busy. It's a Patricia and Sonia, thank you for the wonderful presentations this morning on evoking a lot of thinking around the importance and the value and the requirement, I might add, around why we must continue to develop and work in a collaborative way. And thank you for that.
Yeah, and if anybody has any queries or questions, and I've seen a few things come up in the chat, do feel free to contact me, drop me a line, give me a call. If there's anything anyone's working on or needs a bit of advice on, please do get in contact.
Thank you. And this morning's seminar will be recorded. It is available with the information if you want to share it within your own services or departments. So please come on. It's online. It will be very soon.
Okay.
Thank you again.
Thank you, everybody.
Thank you, everybody.
Thank you.
Patricia and Sonia could stay online just to
okay.
debrief after all that digital chaos earlier. So thank you again, everybody.
Thanks.
Thank you.
Thanks, everyone. Thank you for your time.
Thank you.